know what, it wasn't a big deal after all.
Okay, good. I'm glad. I had the shingle shot a couple of years ago. And so I don't have very much of a recollection of it, but a little bit of a sore arm for a couple of weeks. So otherwise, it was good. Today, we're here on the Avaz podcast because we wanted to talk to you about what sort of seasonal flus, colds, and other things we need to be protected from. And one of those things is, aside from protecting our kids and getting vaccinations for our kids, we do need to get certain vaccinations as adults. We forget that even though we're getting older and we have most of our vaccinations when we were children, there are certain ones that we would benefit from as adults because that will reduce the cases of hospitalization. It will reduce the cases of illnesses leading to death. And so one of those is a vaccination for shingles. Dr. Jeethi, you want to talk to us about Dr. Jeethi, do you want to talk to us about what shingles is?
Sure. So shingles, some of you may know it as zoster, and if you're medically inclined, herpes zoster. It's a painful rash that is caused by the varicella zoster virus, and if that virus sounds familiar, it's because it's the same virus that causes chickenpox. So once you've had chickenpox, the virus stays in your body, and it can rest quietly in your nerves, and you have no symptoms. When the virus wakes up, though, it can cause shingles.
So the virus wakes up. Dr. Madhu, why would a virus wake up and suddenly become active?
Well, the fun part about aging is that viruses can wake up. So basically, once you're over 50, and also chronic health conditions like diabetes, being immunocompromised, like with even people with transplants, cancer, rheumatoid arthritis. So any sort of illnesses, and with age, those are the two main issues that sort of wake up the herpes zoster virus to cause shingles.
Okay. Dr. Nav, can you shed a little bit of light on what the symptoms are of shingles and how they're different from the symptoms of chickenpox?
Sure. So chickenpox is an illness that causes a rash all over your body, and it usually occurs the first time you've been exposed to the virus. So you might get it in childhood, you might get it in adulthood, although recently not recently, but for many years now with chickenpox vaccines, it's really rare to get chickenpox these days, but that is a rash that affects your entire body. You feel fairly ill and unwell, and the rash disappears after a week. So you compare that to shingles, which is caused by the same virus that's been lying asleep in your body, as Dr. Madhu mentioned. Mm-hmm. And when it reactivates, or when it wakens up, then you'll start by having, in just along one part of your body, one strip on one side of your body, you'll feel maybe this burning or this sort of itchy sensation, maybe even some pain that you can't figure out, like, why am I having this pain in the same spot? Like, there's nothing there, I haven't done anything. And then maybe a couple of days later, you'll start to notice the same type of blistering rash that you would get with chickenpox, but it's only in one strip along one side of your body. And I say body, but it actually can occur on your face, on like the top part of your face, the middle part of your face, or the lower part of your face. It can occur along an arm, a strip of the arm, or going across from the back to the chest or abdomen on one side, and the same thing down the leg. And it often doesn't look like a typical rash until more than one set of blistered rashes appear. And so that's how doctors and your primary care practitioner will diagnose it. So it's caused with this, it causes this burning pain, as I mentioned, and then it takes about a week for the rash to eventually dry up and scab over and disappear, similar to chickenpox.
I've heard that it's quite painful from those people that I know that have had it. But how common is shingles, Dr. Jeethi?
Many people don't think shingles is that common. However, it is pretty common. It can occur in up to 20% of people, or like 1 in 5 of people who've had chickenpox previously can develop shingles in their lifetime. And occasionally, a person can develop shingles without knowing that they've had chickenpox in the past.
So you will only have the shingles virus in you if you've had chickenpox before. Is that correct? Okay. So not all of the population will develop shingles. But because when we were younger, in our age category, we didn't get a shingles vaccine.
Well, we didn't get the chickenpox vaccine, which is the same virus. And so this is pertinent to us in our age group. Hopefully it's not going to be an issue for the younger generation involved and vaccinated against chickenpox and the same virus that causes shingles.
So chickenpox is contagious. Is shingles contagious, Dr. Madhu?
Shingles is not contagious in the sense you can't give someone shingles if you have shingles. But having said that, if you have never had chickenpox or the chickenpox vaccine and you are exposed to someone with shingles, then you potentially can get the chickenpox from them because, as we've said, shingles and chickenpox, same virus. So if you've never had chickenpox as a child and if you've never had the vaccine, then if you're exposed to someone with shingles, you could potentially get chickenpox. How? With direct contact from the blister, in some cases through respiratory droplet inhalation. So if you've never had the chickenpox vaccine or chickenpox, stay away from anyone with shingles.
Like we did during COVID time, stay in your room, have somebody bring you your food. You don't want to breathe on them and possibly pass on that virus to somebody else. So are there some serious complications for shingles? Like, could it get worse than just that rash that you talked to us about, Dr. Nab?
Absolutely, yeah. So the most common one is post-herpetic neuralgia, which is basically a big name for saying you get pain where the shingles rash was, and that pain lasts for longer than just the 1 or 2 weeks that you had the rash for. And this is much more common in the elderly and people who have severe disease or have other reasons why their immune systems are low. And just a case in point, my poor mother-in-law had this a few months ago, and she had such a severe amount of pain afterwards that she was requiring painkillers and nerve pain agents for several months, and so it's very, very common for that to happen in the elderly. So that's one very common thing, is having this ongoing pain. And a second thing would be that sometimes if the shingles enters the part of your body, which is this part here across your face, it can also affect the front surface of your eye, the cornea. And if that happens and you don't get it treated adequately, then the rash that appears on your cornea can actually blind you. So it's really important that if you get a feeling that you're like rubbing your eye, that there's something in your eye while you have shingles of that part of your face, that you get it checked out right away. And then there are other things as well, like having like ear inflammation. So those are sort of less common, but the most common one is definitely post-herpetic neuralgia, or pain afterwards.
Okay, so you talk about getting it treated, I guess, as soon as you get some visible symptoms, right? Is that the case? Or would you just think, okay, part of my body is feeling really hot, I should get it checked out? At what point would you get it?
Yeah, ideally, we want to treat it within 72 to 96 hours of the rash first appearing. And the sooner the better. Like, it's not like you should wait up until 96 hours, but sometimes it does take that long to diagnose it.
Okay. And Dr. Jeethi, what is the treatment options for it?
So the mainstay of the treatment is antiviral medication. So as it sounds, it's medication that stops the virus from multiplying, and it can reduce the severity of the rash, and it can also reduce the severity and duration of the pain that follows the rash. And the other part of treatment, going back to the antiviral medication, as Dr. Nav said, it's very important to start it as soon as possible because it's most effective if started within 72 hours of the onset of the rash. That doesn't mean that you can't be started on the medication after that, but you need to talk to your primary care provider about that. And then the other part of treatment is, as Dr. Nav said, pain medication. So if you're unlucky enough to have the pain associated with it, particularly post-herpetic neuralgia, then pain medications are important.
Okay, so if you don't want to go through shingles and you don't want to have to go through the treatment and the rash and everything else, what can we do to prevent it, Dr. Madhu?
Well, the easiest way and the only way to prevent it is the shingles vaccine. The shingles vaccine is called Shingrix. It is 90% effective in preventing complications and the side effects of getting shingles. And even if you do get it, if you're wondering, well, you said 90%, what about the rest? Maybe very little symptoms. So basically, it's very effective. It's a 2-dose vaccine that is done intramuscularly. So you would get 1 dose, let's say now, and then you'd repeat the second dose within 2 to 6 months of the first dose. It's widely available through your doctor's office, through pharmacies, and covered by most insurance plans. So it's a really safe and effective way. What are some of you might feel a little bit sore when you get it, but honestly, that's about it. It's a very safe drug, very safe vaccine.
And so other than a little bit of a sore arm, are there any other potential concerns somebody might have about getting the vaccine, Dr. Knapp?
I mean, there are rare side effects, as there are with any medication or something that is not, produced by our body itself. But they are so rare, and honestly, like I think we're all in agreement that, and all physicians are in agreement that it's far better. The prevention is far better than getting the actual illness, and that is the same for the reason we give vaccines to everybody. The actual disease that you get by not getting the vaccine is much more severe, and you don't want it.
Okay. What about if you've already had shingles? Do you need to get vaccinated?
Yeah, absolutely. So I will tell my patients when I see them that, yeah, you've got active shingles now, but it doesn't mean that you can't get it again, because it is possible to have shingles more than once in your lifetime. And if you've had that pain once, boy, you don't want to get it again. So you definitely want to get vaccinated. So I'll tell my patients to wait at least a couple of months and then go ahead, and they're eligible, and they should get their first dose of Shingrix vaccine after that.
And you guys have said time and time again, it's important to get vaccinated for things that we have already have medically tested vaccines for, to prevent the illness and the complications from the illness. But I'm sure there are some people who think, well, maybe there's some other natural remedies. Are there, Dr. Jeethi?
I wish there were. Well, ginger, turmeric, healthy eating can help with your overall wellness. It's not going to stop shingles. The only proven treatment for this, or only proven effective treatment, is getting vaccinated.
And the vaccine is safe. Millions have used it. And maybe later on in this podcast, one of us may be getting a shingles vaccine.
That would be very exciting, because one of us in this podcast has not yet been immunized for the shingles, and so one of us may need a little convincing. You'll find out who.
Not convincing, it's because one of us is maybe just younger than the rest of us.
One of us may need a little convincing. You'll find out who, and you'll find out why they need a little convincing. So we always talk on our podcast about South Asian women and how some of these health and wellness topics relate in particular to South Asian women. So I'm going to turn it over to you, Dr. Nav. Why does it matter if you are a South Asian woman?
Well, the reason we even started this podcast is because so many South Asian women that listen to us, that are out there in this world, we wear multiple hats. We're mothers, we're daughters, we're sisters, we're grandparents, we're friends, and we do everything for other people, but we put our own health on the back burner. So really, vaccination and adult vaccination is another one of those things where we're like, oh, it doesn't apply to us. We don't need it. We'll be fine. We'll just be sick for a couple of days and then we'll get up and move around again. Well, that's not true, as you've probably learned by now by listening to this episode. And what we want to do is to make sure that we protect ourselves. It's kind of like putting on your own oxygen mask so you can protect those around you in the plane. And in addition to that, there are certain complications that are more common when you have comorbidities or other illnesses in your life, like diabetes. So it's important that we, as South Asian women, are protecting ourselves by getting the vaccine.
Okay. What's a good age to get the Shingrix vaccine?
50.
Yeah.
Okay.
50
So, Dr. Madhu, I know you're young, and I know you're the one of our panel here that has not been immunized.
I haven't. It's honestly, I just keep putting it off. Like Dr. Nav says, it's a back burner phenomenon where, oh yeah, I'll get to it. And now a few years have passed since I'll get to it.
And contrary to what she might say, she is not the youngest of us.
So, Dr. Jeethi, we've heard about the flu. How is it different from influenza?
Well, when we talk about the flu in this podcast, we're actually referring to influenza. And we're talking about the most common strains, which are influenza A and influenza B. Typically, the flu happens seasonally in seasonal epidemics during the late fall and the winter. And the common symptoms of the flu, which we all associate, are fevers, chills, body aches, sore throat, cough, loss of appetite, fatigue. But occasionally some people will also have what we consider uncommon symptoms, such as nausea, vomiting, or diarrhea. Typically, the flu will last 7 to 10 days. However, as we've talked about, there are certain vulnerable populations, such as the elderly or the immunocompromised, and they are at greater risk of developing complications, such as pneumonia, which in that group of people could even be life-threatening. And getting the virus can also make certain chronic health conditions worse and can increase your risk of certain cardiovascular complications such as heart attack and stroke, and increase the risk for Guillain-Barré syndrome.
Which is what?
Which is a neurologic condition that can sometimes develop. It's an ascending paralysis that can develop.
Crazy. It's amazing. That could all come from the flu. So you want to avoid getting the flu. Dr. Madhu, how can you avoid getting the flu? Or how does influenza transfer from one person to another?
That's a great question. So how the influenza virus transmits is really easy. It's basically coughing, sneezing, so respiratory droplets. Also touching surfaces where someone might have coughed or sneezed. Like keyboards, even when you go and punch in your Visa number, your PIN number for the gas or any sales terminal, keyboards, phones, handles, doorknobs, so many things that we're constantly touching. So what we did notice is during COVID, when we were all masking and hand washing, the influenza virus strain there were only, I think in our province, 7 reported cases the entire year, which is unheard of. So since obviously we can't continue to be social distancing and masking, and obviously our hand washing has reduced, that has trekked up back to pre-pandemic levels, which is fine, but that does show you how easily transmissible this is. So again, as Roop has already mentioned, when we're dealing with our more vulnerable populations, I still think we should learn from the pandemic in terms of our hand washing and masking so that we don't make them ill, but it is really easy to get. So vulnerable people should be protected.
And one of the ways vulnerable people can be protected is by getting the vaccine. So Dr. Nav, who are these people that need to get this vaccine?
Well, in terms of eligibility, anybody that's age 6 months or older can get the vaccine, but the question is who should definitely get the vaccine. And as Dr. Madhu has already alluded to, those are people that are suffering from other conditions that would make them at higher risk for developing serious complications. And that includes the elderly, that includes people who have, for example, diabetes or hypertension, high blood pressure, or they've got underlying lung conditions like asthma or emphysema. They might have morbid obesity. They might suffer from dementia. But there are certain categories that we definitely recommend that people get vaccinated en masse in groups. And that is, first is people who are residents of long-term care homes. Secondly, pregnant women. Thirdly, the Indigenous or First Nations population. And fourthly, people of age 65 and older age groups. So those are the age groups that we would say definitely should be getting the vaccine every year.
And as doctors, you all get vaccinated, correct? Because you're exposed to so many people?
Well, we all should get vaccinated. So healthcare workers have the duty to protect the vulnerable populations, the people they come into contact with. So it's very important that we don't inadvertently pass the flu virus on to these vulnerable patients. Essentially, you should talk to your primary care provider about what type of vaccine you should get and how many doses that you need.
Mm-hmm. And I see the campaigns every fall reminding us to get our flu shot. How often do you need to get a flu shot or an immunization for flu?
Well, you actually need to get one every year. And that's because the strain of virus changes a little bit every year. And the vaccine that's formulated every year takes into account those changes in the virus and are most effective for that particular strain that year.
I've heard that from some people that you can get the flu just by getting the flu shot. Is that true?
No, I hate hearing that. I think as doctors, we all hate hearing that. And what happens is the flu shot, like most other vaccines, when you get it, it causes your body to mount an immune response and to build antibodies to that particular virus that you're trying to fight off. And as it's doing that, your body's response is to mount a flu-like response. And so you might get a low-grade fever, you might get some chills, some muscle aches, a headache, but it should only last for a day or two, and then it disappears. And then a week or two later, you've built up your immunity enough that if you were to be exposed to the actual flu virus, influenza virus, then you wouldn't be getting sick with it. So it's not that you get the flu when you get the flu shot, you get the signs that your body is doing the right thing to protect you once it's fully covered and fully created antibodies in your body.
So when you get the flu shot to protect you from the flu, you should expect a little bit of discomfort, maybe on the site, or a little bit of flu-like symptoms, but it's not the flu. So you're better off to be feeling that for a day than you are to be sick with the flu for a whole week, 10 days, or further complications. So that is the flu vaccine. There's another one, and I received this a couple of years ago, the pneumococcal vaccine. Dr. Madhu, can you talk a little bit about that one?
So the pneumococcal vaccine is another important vaccine because it really fights against a bacteria that can cause serious infection in your lungs, your sinuses, your ears, and even your brain or blood. So the problem is when we talk about a bacteria, you can say, well, but you can give me an antibiotic, I'll be fine, I don't want the vaccine. The problem with the antibiotics is antibiotic resistance. And we're really running into this with the pneumonia strain. So what we want people to do is get the vaccine so that you don't even fall ill and have a serious infection. So the biggest problem with the pneumonia strain is antibiotic resistance that we're running into. So we really do want to prevent those complications. When it gets, I have seen patients who unfortunately have had it spread to the brain and have sepsis, and that means it goes into your blood, and those have very serious consequences.
So what are some of the symptoms of pneumonia?
Yes, strep, that particular strain of the bacteria, it's strep pneumoniae. And so some of the common complications or common things that you get from that infection, you can have something mild like an ear infection. It can cause sinus infections, but it can also cause some serious infections, including in the lungs. You might end up coughing up like thick green sputum and having breathing troubles and high fevers. And if it gets really bad, it can spread into your bloodstream and cause we call septicemia, or even go into your brain tissue and cause meningitis. And I have, like, actually quite recently, I've treated people in the emergency department that were quite sick from it. So these are young, healthy people. And if I remember correctly, I think the Muppets creator Jim Henson died of strep pneumonia.
Yes,
so it is a disease that affects younger, healthier people. It's, again, not just the elderly, but it's something serious enough that we should all consider it as a possibility.
And again, it is spread very similarly as the flu virus, so quite easy to get.
So who should actually get immunized, Dr. GT?
So the standard recommendation is that all adults over the age of 60 should be vaccinated. And you should speak to your family doctor or primary care provider about how many vaccines or what type of vaccine you should have to produce the most effective antibody response for you. And this is important because if you do get the virus and you're exposed to it, you can fight the infection if you have already produced the antibodies by getting the vaccine beforehand. And that way you avoid serious complications such as pneumonia or even death.
Okay. That's a lot of information about shingles, pneumococcal, flu vaccine. There's one more, Dr. Madhu, you wanted to talk about RSV.
Yeah, we know RSV is also, this is our last vaccine, a vaccine and illness we're going to talk about that can be prevented through vaccination. So RSV is another respiratory virus, and it causes bronchiolitis, which is inflammation of the small airway passages in our lungs, and it can also cause pneumonia. And again, in people who are more predisposed, who have underlying health conditions, like we've been talking about, the elderly, it can really lead to severe complications that require hospitalization. Right now, I do know of someone who has been intubated and is on a support system so that they can have help breathing so that they can recover. So it is important to address as well. And this usually occurs, again, seasonal, as are other viruses we've talked about, such as the flu virus. It's about late fall into early spring.
And I haven't actually even heard of it. I've heard of the other one, so I'm really glad that you can give us some more information about it. Dr. Nav, how does RSV spread?
The usual way that most colds and flus spread, which is droplets. So if you are talking to someone and they sneeze or cough, and it enters your body through your mucous membrane, so it goes in through your eyes or your nose or your mouth, or if someone has been coughing, let's say, into their hands and they touch a doorknob or a keyboard, and then you touch that same thing before the virus has a chance to die off, and then you say eat something, or you rub your eye, or you pick your nose or something.
Nice
so
example.
yeah, I'm just saying all the different ways it can get into you. So that's why hand washing is super important. So make sure you wash your hands before you eat, and don't touch, just don't, haphazardly out of habit without even thinking about it, touch your face without making sure your hands are clean.
Yeah, and I have that bad habit of touching my face or moving my hair out, and you never know what's on your hands unless you clean them first. Then you're okay. And what are some of the side effects of? Oh, see, there I go. I just did it. I just touched my face. What are some of the side effects of RSV, Dr. Nav?
Some of the symptoms, you mean?
Yes.
Yeah, so you can get, it's very similar.
Side effect.
Yeah, I guess. I mean, it's similar. It's so similar to every other cold and virus. So runny nose, sneezing, coughing. In young people or in the elderly or people that have lung diseases, it can cause quite significant lung disease. So you can get wheezy, short of breath. You might require oxygen for a short period of time. And again, the very young and the very old might need to be hospitalized with it.
That's pretty serious, right?
It
I mean, you
is.
do want to be protected from that. And who, Doctor, do you think, will you tell us who should get immunized? Is there an age category?
So first of all, for RSV, you only need 1 dose of vaccine. And unlike some of the other vaccinations we've talked about, this is generally recommended to all adults that are over the age of 75 or those that are at increased risk of developing RSV. It's also recommended to anyone over the age of 60 who's living in a chronic care facility because they are at heightened risk. And if you're between the ages of 60 to 74, it's best to talk to your healthcare provider about whether you're vulnerable and whether you should be getting this vaccine.
Okay, great. So once again, we are the podcast for South Asian women's health and wellness. And so the question to be asked is, how do these vaccinations specifically affect South Asian women?
I think Dr. Jeethi's alluded to this before, so I'll just reiterate it again. It's one is just us not placing our health front and foremost. I think lack of awareness, so just not knowing that, hey, I should get this done. I also think that South Asians, that sort of fatalistic "jo hona so ho juga" and not doing proactive things to prevent things from happening. Also, we do have a lot of a disproportionate amount of metabolic illness. And by that, I mean like diabetes. In my patient population, I also see a lot of lung issues related to pulmonary fibrosis, COPD, asthma. So all of these underlying health conditions, even just being a little bit overweight, do predispose us to having more serious consequences when we get these infections. So why not do something about it? We have access. We should do something about it, and maybe I'll show you how it's done.
I think we should switch to that. So you said, Dr. Madhu, you said that one of the reasons you hadn't had your shingles vaccine yet was just because you hadn't sort of set aside the time to do so.
Well, I have 2 reasons.
Okay.
So one reason is, yes, I put myself on the back burner. The reason number 2 is my husband's a physician, and it would have been really easy for him to just inject me. And like, what if I had an argument or something with him and he just injected me a little harder, so I didn't quite trust him to inject me.
So this is not.
Can you imagine?
We're not going to talk about that aspect. But
That's another podcast.
That's another podcast. Yes, trust in marriage. But today we're talking about immunizations. Dr. Madhu has agreed to get the vaccine for shingles. Dr. Nav will administer it. If those of you who are watching on YouTube, you can see that she's opening up the package and she's going to mix the 2 vials together, as there's red into green, as I understand, and then she will inject.
I see here it is, like Shingles. That's what I'm getting today.
So I got the Shingles vaccine, I think it was like 2 or 3 years ago, and I remember my arm being sore for a little while. Well, maybe a couple of days, but I knew my mom had shingles before, and I knew how painful it was for her. Like they say, there's a real itching inside. You get at it, and you don't want to scratch it either. So
your mom
my
had
mom
shingles?
had it, yeah.
Oh.
Yeah, I have a very similar story. My mom got it before the age of 50, so even before vaccination is recommended. And I remember she really struggled with post-herpetic neuralgia afterwards and had to be on medication.
Really struggling with this.
And that's why vaccination is important. And the little bit of discomfort you have as a result of the vaccine is not worth that prolonged discomfort you get if you get shingles. So I got mine about a couple of months ago.
You did?
And
yeah, you did.
I did. And I actually tried to do a podcast shortly after getting it. Mainly it was pain, arm pain the first night that I got the vaccine. And then the next day I was really tired.
Yeah.
And I didn't really want to do very much of anything. And that lasted maybe half the day, and then I started to pep up again. And the other thing you can do is if you really feel run down is you can take Tylenol,
Yeah.
and it'll make you feel a lot better as well.
Okay, don't hurt me.
I won't.
Okay, we're now ready
Don't go
to.
high.
We're ready to. Dr. Nav is ready to
See, what
inject
I
us
hate
with
is I do this to other people. Now having this done to me, I'm not looking forward to this at all. But I also understand that I do need to get it. Are you done?
It's done.
You're done?
Mhm.
You're actually pretty good.
She sounds surprised.
Press.
So that's so easy. If you can get an appointment at your doctor's office or wherever you get your immunizations.
You can get it done at the pharmacy.
Yeah.
I'm not sure if the health unit won't do it. So your pharmacy, healthcare provider, your family doctor, it's you should do it. So I will do this now again in 2 to 6 months.
That's
2 to 4
correct.
months, whatever.
2
I'll
to
do
6
it.
months.
I'll do it.
And it is a simple process. You don't even have to get your family doctor involved. You can just go to the pharmacy, and if you meet the criteria, the age criteria, you can go ahead and get the vaccine ordered for you, and they can actually administer a vaccine for you too. So there's less barriers to getting the vaccine nowadays.
So you also have to get a prescription.
No, you don't.
You don't have to get a
The
prescription.
pharmacist can prescribe the prescription.
Oh,
Yes,
I did
in
not know
BC,
that.
yes.
In BC.
Okay, good to know. See, I learned something because they send it back to me. To
So it's
prescribe.
not that difficult to get a vaccine for shingles in particular, just because Dr. Madhu has just had one right now, or same with pneumococcal pneumonia or the flu. So make sure you talk to friends, talk to family, get those who are vulnerable, get them immunized. Share this podcast with those of in your friend group, and let them know this is really important to do, especially now it is flu season, and we want to make sure that we don't spread the virus. Just joy. So thank you all for listening in to the Avaz podcast. This is Group with Dr. Madhu, Dr. Nav, Dr. Jiti, and we hope you had a great time. Please DM us with your questions. We're on Instagram at Avaz_voice. Thanks for listening.